Hi, welcome back. We're about to have our panel now with uh, five speakers and one moderator. Today, our moderator will be Melanie. She's the director of the Big Data and Analytical Unit, part of Imperial College's Institute of Global Health Innovation. And she supports a team of technical science experts to support academic and non-academic work across the college. And they help leverage our data to aid healthcare issues. Before joining Imperial, she was part of McKinsey and Company's healthcare analytics team, where she worked with public health organizations in the US and UK to improve the quality and cost of care through the use of data and analytics. Uh, so, uh, Melanie, are you here?
Yes, I'm here. Hello.
Hello, Melanie. Aside from Melanie, who will be the moderator for today, we have five other speakers, three of which who are academics. There's Samir from and Caroline, both from the School of Public Health at Imperial, and Ting Yuan, who's a statistics lecturer at the University of Cambridge. We also have two speakers who are from industry. We have Pedro from Vodafone and Siddhartha from Microsoft to give us some industry insights on technology and how they have worked with academics to aid certain improvements in healthcare. So I'll give the time to Melanie right now.
Great. Thank you very much for the introductions.
Thank you.
And welcome to all of our panelists. So I think just in terms of the way we'll try to run this, I will start out by asking all of our panelists to answer one question. And for this one, I'm going to hope that you can all answer in a minute and a half or so. And then after that, we'll switch to ask specific questions, one for each one of you. And then we'll try to wrap up at the end with another couple of questions for all of us to sort of discuss and come together. So just to kick off, this is a fascinating time to have this panel, of course. There is so much that is going on. Everybody involved in this panel has been working one way or another to support the efforts to overcome the pandemic using data and analytics. And quite specifically, all of you work on advanced analytical methods that require very deep levels of analytical expertise to fully comprehend. So at the same time, you're also interested in how these models can inform policy relevant questions to ultimately save lives. How do you address the challenge of translation from advanced analytics to policy in this space? And I'll start with Caroline Waters, please.
Hi, thank you. So that's a great question. I'm actually working on a project right now called React in the UK, which is feeding data on coronavirus cases straight into government. And one thing that I will say is, for example, last night we had a group chat of about 2 hours, which was not running any models. It wasn't doing any data analysis. It was just looking at the results of the analysis that we have run, and as a scientific group coming together to try and pull out those key points and try and make sure we're putting them into language that can be understood by non-specialists but also is not misleading, and that just takes a long time for us to go through everything. And then we also reach out to other colleagues, other experts in the field, and run some of this by them before we start feeding this information into the policymakers.
Excellent, thank you. And Pedro, can I come on next to you? So from your perspective, how do we address this challenge of translation from advanced analytical methods to policy and action?
I think the best way of looking into that is by looking at the possibility of having closed data collaborations. So all of these ideas of data collaboratives and having the right partnerships are very important, because I think the main problem sometimes is understanding the capability that is behind all of this data that we have. And we have a very good example at Vodafone. You know, that whenever we work with policymakers, they don't really understand why we can help them. So we kind of need to tell that story and be able to translate our capability into actionable insights. And I think having close partnerships will really help deliver better data-driven policy.
Great, thank you. And now moving on to Xingyuan, could we get your thoughts on this challenge of translation from advanced analytics to policy?
Yes, of course. So I think I'll be a little bit of the pessimistic voice here, and I guess I'm thinking more in terms of the long run. I don't think we will have a magical solution to this, and in order to improve the translation in the long run, I think we first need commitment from the researchers in academia, the scientific journals, and all the government teams to improve the reproducibility of all the data analysis and the scientific studies that are being published and being used to guide the policy. We also need an open platform. If we are going to have a democratic policy, then we need to discuss all these studies and results in an open way, ideally in an online platform that allows us to publish the results, comment on the results, criticize on the results. And as data scientists and also government officials, we also should engage in the platform to build our credibility. And finally, I think even sort of looking further ahead into the future, I think we need education on both sides. We need education for data scientists to let them learn how to influence the policy. And we also need policymakers to understand some basic concepts in data science and statistics. And for example, one important concept or principle, I think, is in these kind of data critical decisions, what's often more important is the quality of the data being used and how the data are being collected, like a careful collection of the data. This is often much more important than the quantity of the data being used and the better, more sophisticated model that are being used. And I think that just hasn't resonated with enough people, both in the data science world and in the government world.
Excellent, thank you very much for that. And now can I get Samir's thoughts, please? So again, how do we move from these advanced analytics models and translate this into actionable policy change?
Yeah, so I mean, through my career, it's essentially been the #1 challenge, right? Which is to develop quite a lot of these novel algorithms, and then sorry, there's someone on, should be on mute.
Sorry, can everybody mute, please?
Yeah, that's right. So essentially, it is to develop these new algorithms, but communicating them to policy is very, very challenging. But the most, the difficult part in communicating this to policy is you're not only communicating your message, you're communicating the limitations, the strengths, and each one of those requires some degree of thought in them. Just to give a couple of examples, because they help illustrate the problem more. If you want to communicate a number, such as the number of new malaria infections in a region, or the number of HIV infections in a region, or the COVID-19 incidence rate, it's a continuous number, and sometimes the numbers get lost. So you could try scaling that to deaths per million. But often, when you've done sophisticated analytics and you do something with uncertainty, you can often distill your results into a question that is specifically what the policymakers want to answer. For example, if policy requires you to know if malaria infections are above 100 per 100,000, then you take your model, and you produce a change surface, just a binary metric that tells you whether you're above or lower. This is an extremely easy thing to communicate to policymakers and an extremely efficient way to put your information out there. Equally, along with that, it's very difficult to really communicate the strengths and weaknesses of this because people just stop listening once they get an interpretation of the results, or people don't understand some of the technical details and just think of it as technical details and ignore them. And so often the strength of a model, the validity of a model, how a model performs, tends to be overlooked. And I'd say there is no answer to this really, but we probably collectively are not doing as good a job on it as we could. I think it requires substantial training and thought.
Understood. Thank you very much. And last but not least, Siddhartha, could I please get your thoughts on this question of translation from advanced analytics to policy and action?
Yeah, no, thank you so much. And I think most of the points have been covered already. So I echo strongly the need for data collaboratives, because it's not just about collaborating about the insights or the information that you bring, but also informing people about the intent of why you are building certain things in certain ways. And the way that we approach this is looking at the passive insights, so where you identify patterns, isolate sort of insights, and aggregate all of them to meaningful actions that you can deliver. The interventions, whether it's about discovering, delivering, or developing new interventions, both on the pharmacy, biopharma side and the digital side, or active interventions that have nothing to do with healthcare, more about the public health space. And then potentially on the equity side, which is this question about how do you affect the individual, the community, and the society. And to answer all of those questions, you need a clear data ownership, dynamic consent, and trust on 3 levels, which is on the trust on the level of people. So why would people share their data or information with you, which is usually easier in the UK than it is in the US because of the aggregation of the NHS. The trust on the level of data scientists, like why should we collaborate and input our IP into this ecosystem, and the researchers, is this replicable, is this reproducible, and the trust on the level of regulation. And one of the things that I think is really powerful is a movement called Data Saves Lives, and we can go more into that, which is around this idea of education about why is this collaborative important. So I think that collaboration, building of trust, and defining the intent are the 3 key metrics.
Excellent. Thank you very much for that. So now the next bit, I really want to sort of deep dive into some of your specific areas of expertise. So if we can start with Caroline. Caroline, you have expertise from working in the government sector and in academia. So from your experience, how is modeling and analytics work in government different from what goes on in academia?
Thanks for that question. So firstly, I can only speak from my experiences at Public Health England in the UK and Imperial College London in the UK. But I think that right now with the pandemic, the differences between the types of work are really quite small in the field that I work in of infectious disease epidemiology, because everybody's trying to answer the same questions about COVID-19. So my old colleagues at Public Health England currently sit on government advisory groups that my current colleagues at Imperial sit on. I think the main differences come in regarding the organisations and their structures and what they seek to do. So in academia, you're focused on journal publications and sort of self-driven research, and you move around a lot and you're trying to win your own grants, whereas working for a public health body, you're much more driven by what the government wants you to look into. But we should note that also your funding is probably going to be constant. You're not going to have to fight to get funding to run some sort of influenza tracking throughout the year. So that's an example of something that might be different. Your public health agency might be getting data on influenza cases sort of all of the time and tracking it to keep an eye on things for the health service. But like I say, right now, I think everybody's working on COVID-19, and in terms of the actual models and the data that people want to use, they will be consistent across the public health body and the academics. And there's a lot of collaboration between the two. Thank you.
Great, thank you. And sort of just to build on that a bit, so do you think there might be actually sort of a difference between the incentives or potentially the motivation for the different directions that advanced analytics and data science take in academia versus government?
Yes, I mean, completely. The funding works completely differently. So the sort of projects that, like I say, you might choose to pick up. So somebody mentioned earlier about things about reproducibility. I think that we try to make all our work reproducible in academia, but when you're the public health body and you're running a system, like I say, with no end, so we'll take influenza again, but it could be tracking norovirus cases. These things are built to sort of run day in, day out. They're not sort of pick up a project, try and make progress scientifically for 3 years, build a tool, put it down. This has to be an operational tool every day.
Excellent, thank you very much. So moving on to our next question. Samir, this one's for you. So your early work on the effect of different non-pharmaceutical interventions to control the pandemic was widely regarded as the basis for many of the government actions to control COVID in this country and beyond. Can you speak about the importance of using inferential mathematical methods to support urgent government decision-making?
Yeah, I mean, it is a difficult question to answer. I mean, first of all, I guess this has been something widely distorted, I suppose, in the media. You know, my work, which was admittedly very public, came out on March 30th, after almost all of Europe had already locked down, and after China had already locked down, and after many states in the US had started to shut down. So it can never really be looked at just as a matter of fact as the basis for lockdown, but rather our method was supposed to be an evaluation of the impact of non-pharmaceutical interventions. Now, despite our best efforts to try to be as transparent as possible, ultimately in a topic as politicized as COVID-19, and with everyone trying to find a balance between economy, personal freedoms, and minimizing the number of deaths, there are going to be strong opinions flowing about. I think as a mathematical modeler, what we wanted to do was use the best possible statistical framework we could. And that's why we used the STAN modeling framework to do Bayesian analysis. We did as much sensitivity analysis as we could. And we kept publishing papers after that to try to improve our methods. And I think that's ultimately the best we can do as mathematical modelers in terms of improving our results. I think what it comes down to is a communication issue, which may or may not ever be resolved properly, which is there tends to be a perception that it has to be this one thing that changes everything. And this is always the way science is disseminated, in that there's one person that gets the prize, when rather than a scientific endeavor. At the time, there were a wide range of models that came out after mine. There are large amounts of other bits of empirical evidence from all over the world in different settings, suggesting the efficacy of non-pharmaceutical interventions. Even in the absence of all bits of this evidence, competing theories, like we had reached herd immunity already in March or in June, or that large swathes of the population have some immunity. These competing explanations can largely be ruled out now with regards to the second waves that we're seeing, and increases in hospitalizations and death. And so, you know, the perception needs to move away from just being, you know, one team caused this misery upon the world, which is just not how it's true, and it's not borne out in any of the evidence. The truth is that the weight of scientific evidence is very firmly in one corner, and while it's very important to have the dissenting arguments, I shouldn't even call them dissenting arguments, where it's important to propose alternative hypotheses to explain the phenomenon that we've seen, it needs to be a large body of high quality evidence together that ultimately makes the decision. And at the viewpoint, we are just some scientists. We do this work under the grant, we publish papers, and we engage in a scientific forum. I try as much as possible not to engage in discourse on social media or discourse in the media on my opinions. I write papers about them. And I think this is the way science should be done. And I understand that early on preprints needed to be out quickly to get a viewpoint out. But you know, if a paper doesn't get published, isn't subject to peer review, isn't subject to other papers discussing it, that's the way science proceeds. It doesn't proceed by, you know, making a declaration on either side or the other. It proceeds by publications coming out and giving a viewpoint. Now, once some scientific viewpoints are out there, someone needs to assess the available evidence. My paper provides one viewpoint. It could be right, could be wrong, depending on other competing parts of evidence. Other sources of evidence, you perform meta-analysis, you look at things together, and then the decision needs to be made. Now, that's the decision maker's job. It's not the scientist's job. It's not for us to tell them. They take the scientists' views. My view was on public health, infections, and deaths. I didn't consider the economy. And then they look at other different views and they put them together. And this, I think, is not well communicated in the public, unfortunately. And so you get this misrepresentation that it is one scientist fighting for one cause, another scientist fighting for another cause, when really we should all just be writing papers as scientists and having our discourse in papers, and keep the shouting at the minimum, keep calls for retracting papers at a minimum, do what we've always done in science and produce papers and see if they're falsifiable, right or wrong. And just as a final viewpoint, I think the public also needs to remember that the object of science is to be wrong, to move it forwards. And the only way, if you follow the philosophy of Karl Popper, the only real way to understand an answer is through falsifiability. And so we keep trying to falsify things. And often I think it's difficult when scientists are put in the public eye to then have to say, yes, I was wrong, but I was wrong for these reasons. And I think it should be something that's praised when scientists say they're wrong, rather than something that condemns science to not being able to understand the truth. The truth is only understood through a process of falsifiability, not through a process of confirmation. I don't know how to communicate these facts, and I guess I'm sort of rambling at this point, so I'll hopefully answered some aspects of your question there.
Absolutely. No, this has been incredibly helpful, and thank you very much for such a candid response. I think what you've said is really at the crux of how we communicate these things and how things are seen, particularly in such a fast-paced environment as the response to COVID. So thank you very much for that. For my next question, also building on academia, so Xinjuan, you found that several early analyses of the COVID-19 pandemic were biased due to sample selection. Can you please say more about the implications that this might have had on government action and policy that were potentially built on biased samples?
Yeah, definitely. I mean, yeah, this is kind of related to what Samir said about like meta-analysis and aggregating all the information. What happened, I think, was perhaps for something new, like COVID. I mean, you're definitely going to make mistakes in the beginning. And if the mistaken answers sort of converge to a round number, that will be taken as the sort of the correct one, at least in the beginning. And that's essentially what we found. So let me just tell you a little bit more about what we found. So first of all, I'm a statistician, and I came to this COVID analysis because I'm actually from Wuhan originally, and I know like what's going on back in January in Wuhan a lot better probably than many others. So I was looking at the data, and I realized that these epidemiological data have multiple levels. I mean, now we're very familiar with these case curves or death curves over the time, but we should always be reminded that these are just aggregated data. Eventually, these are just aggregation of individual cases who have their own course of illness, and so a lot of important information was lost after the aggregation, and very few researchers, in my opinion, actually paid close attention to how the data are collected. At least in the beginning of the pandemic, most of the studies I saw was just collecting some of these kind of case curves region and try to fit some general epidemiological models to them. But it ignores, most of the time ignores how the data are collected and how external events such as the lockdown of Wuhan in January had on those data sets, and that creates enormous bias in these studies. So I think in late January, the doubling time for COVID was, there were two very influential studies, one in the New England Journal of Medicine by a group of people in China, and another paper in The Lancet by epidemiologists in Hong Kong. They found that the doubling time was about 6 to 7 days. And sort of I did some analysis in early February, and we found the doubling time was actually about 2 to 3 days. And we were definitely an outlier at the time. And at that time, there were probably 10, maybe 20 studies already on this single number. And we were definitely one of those that estimated this is growing much, much faster than these very influential papers that were being used by the WHO and all the governments around the world suggest. So it had a lot of, I think, important consequences to how the pandemic plays out eventually. For example, if you look at the SAGE documents, I mean, I can only say that this is from my observation because I don't participate in those meetings. But in the documents released by them, it was pretty clear that they were using that 6 to 7 days doubling time number until about 20th of March. And this was also the number that the Prime Minister used in the first COVID press conference. So I think it definitely, it created a false belief that we actually had a lot of time till the pandemic would hit this country in particular. And it's just quite unfortunate that I couldn't publish our results fast enough. And I didn't know how to communicate with the stakeholders back at that time to be able to maybe change this. But yeah, I hope that answered your question.
It definitely does. And thank you very, very much for that very honest and candid response. I think that is incredibly helpful. So what I would like to do next is move on to Pedro. So Pedro, as lead researcher and data scientist at Vodafone, you have worked on using mobility data to support the COVID-19 response. In your view, what are the biggest opportunities that data science and AI can offer to support recovery from the pandemic? And here, very specifically, I'm asking about maybe these less traditional data sets, such as mobility data, for example.
Sure, I think it's a very interesting question. There are many points of view. I think the pandemic has brought a lot of data to the table, and a lot of people are more data savvy these days. But I think particularly regarding what industry data can provide, I think it's again these partnerships and ongoing partnerships to provide the right tools to evaluate things. So I think much in line with what was said before about making the decisions at a specific point in time, and I think the information that we have available at a certain point in time is what influences a certain decision, and that comes from many different areas. As we move forward, we get more information, and we should adjust these policies, particularly during a time of crisis. And that's exactly where we wanted to be at the forefront of what is possible at Vodafone. So we developed a whole dashboard with mobility insights. So going a bit further than what a normal telecommunications company would provide, which would be just origin and destination matrices. We developed some what we called self-isolation KPIs to look at how people were actually self-regulating and what was the need for government-enforced regulation. And then we also worked with academics on geographical spreading of COVID-19 to see where we could predict the spread. And the idea was always to, and that's why we created a dashboard and gave access to some governmental entities and some supranational entities as well. Because the idea is to have tools that allow us to make the right decisions at the right time. And these ongoing collaborations allow this kind of work. So, for example, we have partnered with the International Monetary Fund, and we uncovered some potential inequalities for women and younger cohorts of people, where their mobility has been more affected, and that actually correlates quite well with unemployment rates across the world. And that is very relevant because it may not mean that that there is a direct causal relationship. Again, correlation is not causation. I know I sound like a data scientist, but it is important to be aware that these inequalities exist and look at the root causes of it and see if there is something that we should do to try to contradict so that we get out of this pandemic a little bit stronger. And particularly in this recovery phase, it is important to have these data tools and this input to our decision makers so that they can see what is the best way of to build back better. So what have we sort of seen destroyed by this crisis, and how can we come back from it? But how can we actually come back and actually address maybe some of the inequalities that we had previously that may have been widened by this crisis?
Excellent. Thank you so much for that response, and very interesting to hear what you all are doing over at Vodafone. As you said, it's not a sort of traditional area or space for a telecommunication company. So very, very much interested to see what else you all come up with. And moving on to also another one of our panel members who are in industry, Siddhartha. So your focus is on approaching technological innovation from a societal impact perspective. So COVID-19 has led to unprecedented deployment of technological innovations across health and social care sectors. Can you share your thoughts on the risks that technological innovations have in driving social and health inequalities, and what can we do to mitigate that?
Absolutely. So thank you for that question. And I do want to thank Samir for his candid response there, because one of the things that we do realize is almost all forecasts will be wrong because you act on the forecast. So the underlying assumptions shift slightly. And that is one of the core things that we've been seeing as we respond globally. Like, we've deployed health bots, we've deployed various things for hospital and knowledge management. One of the things that we saw was the overarching sort of reliance on the data that already existed, which we in the industry would call the low-hanging fruit. And it was needed to be done because when you look at modeling, any kind of modeling, we had lagging indicators for about a year long, like malaria. And I'm not the expert. There are two better people than me to talk about malaria. You would get like a data set about a year ahead, a year after the time, and all of a sudden you were getting real-time data, and you had to sort of build the models in real time. What this also meant was we did not really think about defining the intent and the way that we were collecting all this information. Microsoft has collaborated with various firms and various ecosystems to build some of these data collaborators over time, where the idea has been to make sure that you collect equitable data and understand the biases that exist in the data. And we've open sourced some tools like InterpretML, FairLearn. I think the other academic ecosystems have also sort of shared some of these LionSharp based tools. But the idea is to sort of break through the black box models and understand what are the machine learning models really trying to do. So that was one of the areas where we started sort of focusing on and really doubling down. The other part was looking at the ecosystem. So for example, women's health data was missing from a large part of the ecosystem. And the reason why it was missing was we look at two ways of collecting health information, opting out or anonymizing. And this was a problem because if you opt